The goals were to provide a rehab for alcoholics. It was for that need that the institution was founded.
Integrated healthcare has become the latest buzz phrase of the decade. STAR never set out to intentionally be a model for this brand of healthcare. These services simply developed as part of our facility organically as the organization grew. The seeds for the organization were planted by individuals like the late Dr. Frank Leproux, Ricky Alpert, and others when STAR began as the Center for Alcohol Problems in 1977. They advocated for methods of treating the mind, body, and spirit to overcome the disease of addiction. This influence is felt far into the future. STAR was one of the earliest agencies to establish an inpatient detoxification facility and the first facility in southeastern Massachusetts to detoxify pregnant women. When the HIV pandemic hit this country, STAR drew on the foundation of this work, adding primary health care to the services offered. Subsequently, other cutting-edge programs were created to respond to the need. We were the first to open an HIV counseling and testing clinic. In 1995, STAR was the first private agency to offer year-long residential treatment for pregnant women battling addiction and their children. We continue to plant seeds in the soil these individuals prime during the early years to offer quality integrative treatment for people battling addiction in our area. Our response to the diverse needs of clients has been to offer a one-stop shopping model with many branches of care. These are cultivated in response to community needs. We offer inpatient and outpatient substance treatment services, a women's center that provides individual and group therapy, support groups, and legal advocacy. Project Aware, which provides a multitude of services to people living with HIV, including education, confidential counseling and testing, integrated medical case management, and screening for hepatitis C and other sexually transmitted infections. The Family Health Care Center at STAR offers a full range of preventative and primary care services for the whole family. STAR offers a myriad of special programs for adults, family, children, and teens.
Now that I do well, I feel so open and feel good about myself.
STAR's reach has expanded over the years to include our global colleagues. Through international exchanges, we share the fruits of our labor and learn through our colleagues' experiences.
Family healthcare side, and I just saw our pediatrician go with
STAR is pleased to be part of the National Institute of Drug Abuse Clinical Trials Network, in conjunction with 17 academic centers and 120 community treatment providers. Through our relationship with the American International Health Alliance, STAR began its first humanitarian medical mission, first traveling to the former Soviet Union state of Georgia to attend the AIHA's first substance abuse conference. Then next to Russia to participate in projects helping people living with AIDS, and in Armenia, where we shared healthcare information and nursing skills. In 2005, STAR was selected to be part of TreatNet, an initiative of the United Nations Office of Drugs and Crime to work collaboratively to improve treatment quality throughout the world and to provide rehabilitation services including HIV prevention and care. STAR was one of only 2 resource centers in the United States and the second of 20 worldwide to be selected to be part of TreatNet. Sponsored by the United Nations and the United States AID, masterclass trainings allow STAR to continue to provide education and consultation to addiction professionals both in the United States and Russia. At STAR, we understand that the population's need will invariably shift according to changes in the social, cultural, biological, geographic, and economic environments. We have a long history of growing cutting-edge programs in response to these shifts. STAR was recently chosen to administer a multi-million-dollar federal grant helping people at risk for substance use, mental health issues, or violence due to extended unemployment. Through the grant, we developed Project Assist, which created programs reaching the community. Staff travel to off-site locations to administer screenings to access individuals for a variety of related issues. Case managers provide services for those who identify risk, including job referrals, job mentoring, help obtaining services like food stamps or heating assistance. Innovation like these allows us to continue to blossom, to promote best practices in the field of addiction, medicine, behavioral health, mental health, and social services. This year, we opened STAR's South End Services, the first integrated primary health care, behavioral health care, and methadone clinic in Massachusetts. The satellite site in Fall River's South End offers state-of-the-art facility and a staff of dedicated nurses, doctors, caseworkers, and HIV specialists to respond to client needs.
This really allows us to have integrated care, primary care, behavioral health, and substance abuse treatment all under one roof. But what many of you already know is that STAR's been doing that for years.
This will save money in the long run because by integrating the approach, putting primary care, behavioral care, and substance abuse care all together, you're using your money more effectively.
Because it is, as Nancy said, the first in Massachusetts of integration of behavioral health and primary health care.
It's so great to be able to take a concept and an initiative that we talked about 2 years ago and be able to cut the ribbon on it today. Congratulations, and I know that this facility will benefit so many who come here to use it. Thank you.